Last but not least, the female reproductive system. You should be able to tell me where to find the objectives by now. What does it do? It creates and supports new life. The ovaries produce the eggs, the uterus contains the baby, and the breast produces milk. The external genitalia is behind the mons pubis and contains the vulva, the labia majora and minora, the clitoris, Bartholin glands, and the vaginal opening or orifice. Breasts are made of fat, connective tissue, and glands. The milk flows through the lactiferous ducts to the nipples. The internal genitalia consists of the ovaries. Women have 2, and they hold the eggs or oocytes. Each follicle or egg sac holds 1 oocyte. The fallopian tubes arise from the uterus, and it is the channel where the fertilized egg travels to the uterus to implant for pregnancy or conception. The infundibular end is cone-shaped and has fimbriae, which are finger-like extensions that help to guide the cell into the tube. The uterus is a muscular organ between the bladder and the rectum. Part of the uterus is the fundus, or the top, the corpus, or the body, and the cervix, which is at the distal end that leads into the vagina. Uterine tissue consists of the perimetrium. Peri means around, right? So it's the outer layer. The myometrium. Myo means muscle, so the muscular middle layer. And the endometrium. Endo means inside, so the inner layer. The vagina is the tube that extends from the cervix to the outside of the body. What are the finger-like projections at the end of the tubes? The fimbriae. Menarche is the first menstruation. Menstruation is called menses or the period. It's when the uterine lining that was preparing for a fertilized egg to implant sheds the lining when conception does not occur. The menstrual cycle consists of the menstrual phase, bleeding. The follicular phase is when the egg is maturing. The ovulation phase is when the ovulation occurs, and the luteal phase, which is after ovulation when the body is readying for pregnancy. If it doesn't occur, then it readies to shed the lining, starting the menstrual cycle over again. Climacteric is where the ovaries start to wind down as the egg supply does. This includes the time around menopause, peri, menopause, and post after menopause. What is the menstrual phase? Bleeding, when you're on your menses or period. Obstetrics is the study of pregnancy and the time at childbirth and shortly after. The egg oocyte is an unfertilized egg. The process of maturation is called oogenesis. When it matures, it ovulates and is released. The sac remains, and it is called the corpus luteum and produces progesterone in anticipation of supporting a pregnancy. The oocyte is drawn to the tube through the waving action of the fimbriae and is fertilized by the sperm at the end of the tube. The developing embryo develops as it travels down the tube while the uterus prepares for its arrival, and implantation occurs when the embryo arrives. If there is no embryo, then the lining is shed with the next menses. Fertilization occurs when, during intercourse, the sperm fertilizes a mature egg. The fertilized egg is called a zygote. The zygote develops into the embryo, and the embryo is defined as a fetus from the 9th week of pregnancy. Every once in a while, you get more than one baby. Fraternal twins are from 2 separate eggs and 2 separate sperm. The woman ovulated 2 eggs instead of 1. Identical twins arrived for the same zygote. There's an error in division that causes 2 embryos to develop from 1 zygote. Higher order multiples are anything above twins like triplets, quadruplets, etc. Structures of pregnancy are the chorion. That's the outer membrane that holds the embryo and helps to form the placenta. The placenta forms within the uterus and allows for nutrients and waste to exchange between the mother and the baby. There is no blood exchange. However, there are some toxins, pathogens, drugs, and chemicals that do cross the placenta and may affect the baby. After birth, the placenta comes out. Other structures of pregnancy include the amniotic sac. That is the innermost membrane surrounding the embryo in the uterus. The cavity is a fluid-filled space between the embryo and the sac. The fluid is what the embryo floats in to protect it from trauma. The umbilical cord is the connection between the mother and the baby that allows for exchange of nutrients and waste. The place where it is attached to the baby is where the belly button is. Gestation is the development of the fetus during pregnancy, which is usually about 40 weeks. The first trimester starts at the first day of the last menstrual period to week 13. The second trimester is from week 14 to 27. During this time, fetal movement is detected by the mother. The third trimester is from week 28 to 40. Towards the end, the fetus will drop lower in the abdomen, preparing for birth. The age of viability, which is the age the baby would be able to survive outside of the womb, is generally considered to be 24 weeks. Antepartum is the period right before the onset of labor. AMA is advanced maternal age, considered to be anyone over the age of 35 where the risk of complications during pregnancy are higher. Gravida is the number of pregnancies, not deliveries. Primigravida is the first pregnancy. Para is the number of pregnancies over 20 weeks or delivered. Primipara is given birth to one child. A multipara is birth to more than one live child. Parturition is the process of giving birth or delivering. Braxton Hicks contractions are irregular contractions without dilation of the cervix, also known as false labor. The stages of labor. The first stage is with regular contractions and dilation of the cervix. The cervix shortens and softens, getting ready to expel the baby from the uterus. The rupture of the amniotic sac or water breaking tells us we need to be seen. The second stage is when the cervix is fully dilated or opened to 10 centimeters, and the baby begins to come down the vaginal canal. The baby should present head first or cephalic presentation. The third stage is expulsion of the placenta. Postpartum is the time after birth. Puerperium is the time from delivery of the placenta to 6 weeks post-delivery. Lochia is the vaginal discharge that can continue up to 6 weeks. Uterine involution is the return of the uterus to normal size. The neonate period for the baby is the first 4 weeks of life. Vernix covers the baby when it is delivered. It was the protective covering for the baby in the uterus. Meconium is the first poop or feces from the intestines. Lactation is milk production in the breast for the newborn. Colostrum is the initial milk produced, and prolactin and oxytocin are hormones that contribute to milk letdown and production. When do you feel fetal movement? The second trimester. Which is the word part describing the temporary organ formed during conception? Placenta is the temporary organ, so placento. Who has just given birth once? Primipara. Here are some specialists involved in the female reproductive system. Who is not medically trained? A doula. Which one is the muscular layer? What is muscle? Myo. So myometrium. Problems with the female reproductive system include issues with ovulation, cysts or tumors on the ovaries, or pathology involving the tubes. Sexually transmitted diseases can cause or exacerbate pathology in the reproductive systems for both men and women. Disorders of the uterus include endometriosis, cancer, fibroids, and prolapse. Problems with the cervix can be cancer or precancerous lesions. It can be inflamed, cervicitis, or weak, where the cervix is not strong enough to maintain a pregnancy past the first or second trimester, called cervical incompetence. The vagina can have a variety of infections with either bacteria or fungus, resulting in leukorrhea, which is a whitish vaginal discharge. It can be inflamed, as in vaginitis. Vaginismus is involuntary spasms of the pelvic floor, which closes off the vagina. Very painful. Can also be the source of dyspareunia, which is painful sex. Cystocele is herniation of the bladder through the vaginal wall. Disorders of the external genitalia can be inflammation or vulvitis, or pain from an unknown source called vulvodynia. Breast pathology can be masses, cyst, inflammation, pain, or continued milk production past the time of breastfeeding. Pathology of the menstrual cycle are not having one, amenorrhea. A painful one, dysmenorrhea. Too much bleeding, menorrhagia. Too little bleeding, hypomenorrhea. Bleeding in between cycles, menometrorrhagia, and abnormal uterine bleeding. Oligomenorrhea is infrequent and irregular bleeding. Poly is too many cycles. Premature menopause is menopause before 40 years old. PMS is premenstrual syndrome, which is a variation of normal. And premenstrual dysphoric disorders is PMS on steroids. What is intermenstrual bleeding? Metrorrhagia. Pathology during pregnancy can be abortion or miscarriage. Induced is caused by intervention. Therapeutic is done for medical purposes. Abortifacient is a medication that causes abortion within the first few weeks of conception, or an induced abortion can also be surgical. An ectopic pregnancy is a pregnancy that is implanted in the tube and not the uterus, potentially life-threatening if left unaddressed. Complications during pregnancy can be cervical incompetence that we touched on before. The cervix is too weak to hold onto that pregnancy as it grows. Gestational diabetes occurs in pregnancy. and the placenta can prematurely separate from the uterus, or it can implant so deeply that it does not release from the uterus after birth. It can be implanted abnormally in the uterus, partially or completely covering the cervix. Preeclampsia is hypertension and proteinuria, which if left uncontrolled can worsen, leading to eclampsia with seizures and a coma. Gestational hypertension is high blood pressure during pregnancy. Hyperemesis gravidarum is excessive vomiting in pregnancy. Implantation bleeding is most common post-conception. And HELP is a life-threatening combination of symptoms that can cause liver and blood cell damage. Sometimes women can experience hyperpigmentation issues due to hormones, such as melasma or linea nigra. A molar pregnancy is abnormal and hyperdivision of the fertilized egg that can lead to cancer. Oligo or polyhydramnios is less or more amniotic fluid than normal. Rh factor is an issue if the mother is Rh negative and the baby is Rh positive. Problems during pregnancy are breech presentation, where the baby comes out butt or feet first. Labor that is too early is preterm labor. Amniotic sac rupture before the 37th week is premature rupture of the membranes. So a premature birth is birth prior to the 37th week, and postmature is after 42 weeks. A stillbirth is a fetus that dies before or during delivery. Depression can happen at any time during pregnancy, generally due to hormonal changes. If it lasts more than 2 weeks, treatment may be needed. Depressive feelings are normal as hormones shift postpartum, but depression can also set in at this time. Excessive bleeding or after conception is called implantation bleeding. How do we diagnose problems? We test tissue by pap smears, colposcopy, or we use a scope to look via hysteroscopy. We can also use ultrasound and X-ray. Testing during pregnancy is blood testing and ultrasound. To test for the health of the fetus, amniocentesis or chorionic villus sampling helps to determine if any genetic abnormalities exist. Group B strep is tested for in the last trimester because the baby can be infected if exposed during delivery. Stress testing can be done to see what the fetal response will be during delivery. You can internally or externally monitor the fetus during labor. You can check the fetal scalp pH to determine oxygenation. A positive pregnancy test from a healthcare facility is considered a probable pregnancy sign. Here are some forms of birth control: abstinence, pills, implants, barrier methods, IUD, and having your tubes tied or tubal ligation. You can treat menstrual and menopausal problems with hormones. You can surgically treat ovarian and tubal issues. Here are some treatments for various pathologies. Removal of the uterus or hysterectomy can be either partial, where the cervix is left, or total, where the uterus and cervix are removed. A radical hysterectomy is removal of the uterus, cervix, and part of the vagina. Bilateral salpingo-oophorectomy is removal of both ovaries and tubes. Treatment of breast disorders include augmentation or reduction of breast tissue surgically. These can be done as reconstruction as well as for cosmetic reasons. What is the surgical removal of the tube and ovary? Salpingo-oophorectomy. During pregnancy, a cerclage can be performed in an incompetent cervix. Sutures are placed to reinforce the cervix. Cesarean sections are deliveries via incision in the abdominal and uterine walls. VBAC is a vaginal delivery after cesarean section. An episiotomy is an incision made into the perineum to prevent tearing during delivery. Pain relief can be with an epidural block or spinal block. There are many modalities to help those patients who are having difficulty in getting pregnant, like insemination or in vitro fertilization. Here are some common abbreviations also listed in your text. What X-ray helps us to visualize the uterus and tubes? HSG. Hystero is uterus and salpingo is tube. So hysterosalpingogram. Breast reconstruction after mastectomy and radiation is what? Well, not A or B because reconstruction is not in the answer. If it is after, does that make it immediate or delayed? Delayed reconstruction.